Hi, my name is Michelle Wadsworth, and I will be presenting a case study analysis of a patient with atrial fibrillation from my Nurse 442 online class. To begin, I introduce to you a patient we call JZ from her initials. All other names will be pseudonames as well. The patient is a 62-year-old female that was born and raised in Burma and came as a refugee with her children when her husband passed away, fighting against the tyranny of the Burmese government. Since her husband passed, she has never dated nor remarried, but has remained widowed for the last 22 plus years. Jay-Z has 4 adult children. Jane is a 33-year-old adult female that remains single. Maria is married to a pastor, lives in Arizona, and has one son that is 4 years old. Dan is dating and living in Arizona. Bernie is married and living in Arizona with his 2 boys, ages 9 and 2. Jay-Z has a total of 3 grandchildren. Jay-Z forcefully retired by recommendation of the doctor and inability to keep up with her high-demand job as a CNA in a convalescent home. She has Medi-Cal as a health insurance, and she's learning to juggle and manage her recent diagnosis of AFib. Jay-Z is fully reliant on daughter Jane for her needs, as Jay-Z never learned how to drive and doesn't know how to set up her own doctor appointments and follow-ups. Self-care capacity. Patient is no longer able to maintain her required job duties as a CNA. After changing and turning total care patients, Jay-Z was feeling chest pains and having sporadic elevated blood pressures with feelings of malaise. Patient is unable to schedule or even drive herself to medical appointments. She relies on her daughter Jane, whom she lives with, to drive her and coordinate her medical care. Jane is the sole provider of financial income for Jay-Z, and she takes responsibility for purchasing and paying all the other bills, such as rent, electricity, water bills, etc. Jane lives in a 3-story apartment building, and getting up and down the stairs is difficult for her. Jay-Z also relies on Jane for companionship. Jay-Z is able to self-ambulate without any extra equipment or support, and she's able to perform ADLs and enjoys cooking for herself and her daughter. Priority patient issues for discharge planning. Can patient state understanding of her diagnosis and treatment? Patient Jay-Z's native language is not English. She speaks Burmese, Thai, and her first language is Karen, an indigenous group of the Thailand and border Burma. Jay-Z speaks English as her 4th language, but it is somewhat broken. It is important to assess for understanding and her diagnosis of treatment that she's receiving. Who will take her to follow-up appointments? Jay-Z can't drive, and walking long distances is cumbersome for her, as she gets chest pain and shortness of breath. The daughter Jane has agreed to ask for time off from work in order to take her to appointments. All the other siblings live in a different state, so by default, the responsibility falls on her. Who will pick up her medications and refill? Jane will also be picking up her mother's medication. She states she's able to swing by on the way home from work. She lives near a pharmacy. Will she be able to continue working? Jay-Z has decided to retire earlier than she wanted due to her health condition. Jay-Z loves interacting with her patients and building relationships that way, but it's taking a toll on her physically. Who will she be going home with? Jay-Z will be living with Jane, as Jay-Z has increased fatigue. Priority patient issues for discharge. Will a discharge to Jane's place be appropriate if she lives on the 3rd story of an apartment building? The daughter Jane seems to be the solution to most of Jay-Z's dilemmas, such as rides, appointments, and medications, but Jane lives on the 3rd-level apartment building, and Jay-Z has had increased fatigue. Going up 3 flights of stairs might be too cumbersome for her. Jane shares that there is an elevator on the other side of the parking lot, and that she would request from the apartment managers to have her parking slot switched to one that is closer to the elevator. Going up and down via the elevator would not be troublesome for Jay-Z. Interventions for the system-level nurse case management. EKG was done, and that showed atrial fibrillation. Holter monitoring for the doctor to further evaluate her heart rhythm. Medication to help control heart rate and blood pressure, as well as blood thinners to prevent blood clots. Labs, blood tests are done at hospitals and at the clinic for the patient to monitor PT-INR levels or to rule out thyroid malfunction with initial diagnosis. Jay-Z had follow-up visits by the home health nurse from the hospital. A cardioversion was done with no success with the first attempt. As a result, a cardioablation is planned next month. Interventions for the patient's level nurse case management. Eat heart-healthy foods. The 2015 to 2020 dietary guidelines for Americans suggest limiting sodium intake to less than 2,300 milligrams per day for individuals over the age of 14, and points out the benefit of 1,500 milligrams per day for those with prehypertension and hypertension. American Heart Association 2016. Exercise regularly. Although Jay-Z gets easily exasperated with too much physical activity, it's still important to implement some form of exercise to her limitations. Maintain healthy foods. Her culture cooks food that might have a lot of sodium. She will have to learn to kindly say no and decline. Keep blood pressure and cholesterol under control. Eating healthy will help keep cholesterol down. Patient must also be taught how to take her own blood pressure. Continue taking the medication regimen. Jay-Z must continue to be compliant with her meds and take them in a timely manner. Maintain follow-up examinations and lab work. This is important to monitor effectiveness and maintain a therapeutic level of blood thinners to prevent blood clots. Maintain her psychosocial support and mental well-being. Dealing with a new diagnosis can be overwhelming. It's important to seek support among friends, family, and within her own community. Spiritual care. A patient began losing hope dealing with her chronic illness and became non-compliant. Hope can be a psychosocial resource for adults who are dealing with chronic illness. A meta-analysis of qualitative research on the hope experience from 1980 to 2010 concluded that older adults may experience hope differently than younger adults. Resources for hope are both internal and external. Finding meaning and positive appraisal are important to help older adults maintain hope. The daughter sought to reinstill hope in her mother by reaching out to her church community. People use faith and benefits and beliefs as a coping resource, and these beliefs often originate from and are informed by family culture and traditions. Jane was also able to reach out to some of the elders in the church that Jay-Z used to teach in their native tongue, and through that outreach, some members of the church were able to make arrangements to conduct a weekly Bible study at Jay-Z's home. The gesture gave Jay-Z something to look forward to, and reciting scripture with the other members in her community gave her hope to keep moving forward and not give up. Utilization review is described in our textbook as a process in which medical review determinations are made based on clinical guidelines and structured process. Utilization review modalities use established criteria to evaluate medical services for necessity, level of care for appropriateness, quality, and timeliness of discharge. Utilization review occurs throughout admission, discharge, and in follow-up care provided by the hospital. Quality and safety. Quality and safety. Ensure that the patient is being compliant in order to assure the optimal quality of care. Maintaining universal protocol with patient care since the patient ended up getting pneumonia during flu season in one hospitalization. Patient is able to safely take her medications within parameters stipulated by the doctor. Able to take her own blood pressure and understand readings of when to take meds and when to hold. Administer vaccines yearly, such as the influenza, to prevent diseases. Nurse case management effectiveness. At the system level. At the system level, the patient had diagnostic tests performed to confirm AFib and was prescribed medications, Xarelto, to thin blood and a beta blocker to control heart rate in order to manage her condition. Nurse case management effectiveness at the patient level. Implementing a heart-healthy diet with sodium restrictions, while also doing weight controls, monitoring her weight at least on a weekly basis. Jay-Z's cholesterol level, sodium levels, PT-IR levels, and home follow-up visits by the nurse will determine patients' compliance with their diet and medications. At the patient level, Jay-Z can self-monitor blood pressure, heart rate, and know when to go to the ER. Self-empowerment is important at the patient level in order to keep herself motivated, encouraged, and willing to implement the changes she's capable of doing to have the best life she can while managing a chronic illness. Here are my references. Thank you for watching. It's been a pleasure conversing and learning alongside with you on this online course. Best of luck to all.